Rodriguez. She'll be answering most of the questions because she is our benefits expert. I'm just here for moral support. So we thought we'd start with just a really quick, who is the consortium? What is this change that you're going through? But to really start at the top. And some of this, I'm sure, you are going to question about our mission statement when we had an 18% premium increase for 2020. Our mission statement is to provide an efficient intermunicipal cooperative to combat and to remain with high quality, cost stable health insurance. So cost stability is our main mission and continues to be our main mission. So why did we give an 18%, a 14% last year, and maybe 18% next year? We have been very diligent with raising our reserves. And several years ago, some of our members said, you have too much money in the bank. This is taxpayers' dollars. We want to draw down on the reserves. So we kept our rates stable and very low. Unfortunately, at the same time, costs of prescription drugs were going way up and cost of medical claims due to just a general increase in costs, as well as new technology coming into play that's very costly. So our claims in general have been going up, and we are now responding to that to kind of right the ship because we have depleted our reserves, and all these years of rate stability that we have been experiencing, we're going to have to right the ship again to keep that for the long term. So the consortium is still a great concept for intermunicipal organizations to come together to offer a better benefit. Kylie's going to show you some slides later where our premiums are still lower than Excelis and Excelis plans that you can get out in the open market. So we know we're still competitive and that together we are stronger and better. All right, I'm not sure why that's not working. That's good. If you have a hard time sleeping tonight, you can read up on what an Article 47 is. But we bring this slide up, not so much to talk about the exact details, but to let you know that we are governed by New York State insurance law. It's under Article 47. We're, as an organization, we're governed under general municipal law, but when it comes specifically to insurance, this is where our regulators live. We have to report to them quarterly, we report to them annually, and anything that we change, like our municipal cooperative agreement, which the city of Portland is asked to sign every year, must go through them. It also means that any New York State mandate to your benefit, we must put into our program. For example, New York State has mandated that diabetes related prescriptions are zero copay. So we had to put that in last year, the year before. This year, January this year. Like I said at the beginning, we have grown significantly. We are now available in 18 counties. And the reason we bring this up is to say the larger the risk pool, the better it is for the group. So if you're one small municipality in a much larger risk pool, it doesn't hurt you as much as if you were standing alone and self-funded. Here's all our members. We are adding 10 more municipalities for 2026. I already have done 4 or 5 comparisons for 2027. So even though we're feeling like, oh my gosh, this premium is really going up, people outside the consortium are saying we can't afford these prices anymore. How can we get into the consortium? In general, we offer some additional benefits to, the open market. So the first thing we ask everybody to do when you have a question about how your claims was paid is to call customer service at Excelis. We have a dedicated line at Excelis, so you're not calling with all the people on our open market that call Excelis. You are calling into a special group that knows your Article 47 and can answer your questions related to Article 47 business. Now, I'm going to tell you, once you call that, if you still don't like your answer, you're going to call Kylie. And that, I say, is our secret weapon. Kylie and her team know your benefits and will take the time to walk you through. At the end, Kylie is going to offer each of you individually, because we don't want to discuss your personal prescriptions in a group meeting. But if you're trying to figure out, would this plan change, what's going to happen to your prescription, Kylie can take that phone call and do that for you. There's not a lot of other insurance companies out there in the market that will give you that personalized care and know what your benefits currently are and how they're going to be paid tomorrow. So the good thing is you're still with the consortium, whether you're switching from classic blue to platinum, or from platinum to bronze, or classic blue to bronze, you are still with the consortium. After us tonight, I think they're before us tomorrow, that is not with the consortium, the Medicare Advantage plan. So that will leave our domain and go into another great shared service servicing New York. And it is still with Excelis as the third party administrator, but it doesn't come through us. So if you are going on the MAPD and you call Kylie, she's going to refer you elsewhere. So just letting you know that. For those of you who know about our wellness program, the wellness program is still part of the Bronze Plan. We have some great activities. Our book club this year, really centered around mental health and personal well-being, was a huge success. We're moving into Maintain, Don't Gain during the holiday season. So there's a lot of things you can take advantage of, including the Blue for You clinics that happen when we're doing some biometric screening, if you elect to participate in them. Kylie is usually better at talking about CanRx, but with the Bronze Plan, this is a discounted prescription drug program. It's separate from us, but we have contracted with CanRx to get prescription drugs, brand name prescription drugs to you at zero copay. That will still be offered with the Bronze Plan. And if you haven't taken advantage of this program, Kylie is going to probably give you an example of Eliquis later tonight. Eliquis is a brand name, not mandatory, maintenance drug that many people are on. It's an expensive drug. If you were to contact CanRx, you could have that drug shipped directly to your home at zero copay. So it's something you want to learn a little bit more about. And that is part of the consortium. So I know you didn't want to learn about the consortium tonight. You're going to want to know more about benefits, but I'll take a question before I sit down.
Question about CanRx. I get one of my medications through CanRx, which is zero copay. A couple of weeks ago, I got a letter, I think from Excelis, saying that this medicine, they will, to talk to your doctor because they won't copay it and they have to go to a different medicine. If I stay with CanRx, am I still okay with that same medicine?
As long as it's done on the CanRx formulary, yep. I mean, the CanRx formulary does shift twice, January and then June, but normally it's not a lot of meds, and normally they're adding to the list rather than taking away. I have seen it where like Nexium comes off, goes back on. It depends on how they're working that out with a supplier, but for most meds, it's consistent. And CanRx is separate from your health insurance, so it's a voluntary prescription program. So the letter from Excellus, you could ignore it, keep going if you can. Yeah,
But I will let you know, Excellus does help us control costs with prescription drugs that are going through our regular insurance program. So they will contact members that are on expensive drugs to say, here's a lower cost available to you, same drug or same formula, just not a brand name drug. And that's gonna be important to know when Kylie starts talking about the bronze plan, because your prescription drugs are gonna pay a lot of that deductible. So you may want to go with less pricey drugs. It's must be after 5, I can barely talk now. You know, and how you're managing your HRA, which Kylie will talk about as well. So I introduce our expert, Kylie Rodriguez, to talk about the bronze plan.
and I did bring handouts with me that talk about ways to save on your health. You're welcome to pick these up after, you don't need them now. But it kind of talks about some of the programs that reduce down how much you're spending on claims, talks about CanRx, talks about using MD Live instead of an emergency room if all you need is antibiotics for an infection, things like that. So feel free to grab those as well on your way out, and I will email that to you too, just so you have it for your website.
Thank you.
So before we talk health insurance, a lot of times I want to make sure we're all on the same page. So I know probably most of you know what these terms are, but I'm going to go over them quickly. So that way, when we start talking about a deductible has to be met before you get to your co-insurance level, you know what I'm talking about. So a deductible is the amount you have to pay before your health insurance kicks in. So for example, on the bronze plan for an in-network individual deductible, it's $7,000. That's a deductible. Maximum out of pocket takes your deductible, your copays, your co-insurance, adds them all up together. Once you've reached your maximum out of pocket for the year, you have 100% coverage for the rest of the year. So the fun part about the bronze plan is that $7,000 deductible. There's also a $7,000 maximum out of pocket. So once you reach your deductible, you're also meeting your maximum out of pocket at the same time. Co-insurance. Co-insurance is the percentage you pay for a visit. So for example, on our platinum plan, we cover durable medical equipment at 80%, you would pay a 20% co-insurance. Versus a copay, which is a set dollar amount you pay for a visit. So on our platinum plan, it's $25 to see a specialist, a set dollar amount for that visit. So I'll talk about this in a minute, but so the bronze plan is a high deductible health insurance plan. The platinum plan, which is currently offered voluntary, which will be shifting to bronze, is a copay plan. And then the classic blue plan is what we call an indemnity plan. Do you need to remember all that? No, not really. But they all work a little bit differently. So we're going to talk about that throughout the conversation. Feel free to ask questions about how they all work. So right now, for next year, the bronze plan will be paired with what's called an HRA. So what is an HRA? An HRA is a health reimbursement account. It's money that the city is putting into an account for you. So then you can use it to spend on expenses because the bronze plan benefit doesn't kick in right away. You have that $7,000 deductible, right? So it'll help offset those expenses. So as I talk about the benefits, I'll remind you about the HRA being used for some of the expenses because it's going to look like the bronze plan is a really reduction in benefits. But when you pair it with an HRA, it's very comparable in benefits. So the HRA does have limitations, right? So you can't just go swipe it for some vitamin D at the pharmacy. You need to be using it for medical prescription claims, things that are going to go through your health insurance, and then you pay with the HRA. One of the things that I've seen with other municipalities is doctors trying to get you to prepay. Well, we see you have a high deductible, so you need to prepay for your visit. Don't do that. They need to bill you. It needs to go through Excellus, because Excellus, even though if you haven't met your deductible, still discounts that cost, right? Because they have their own allowable rates they've worked out with doctors. Goes through Excellus, they send you a bill, you put your HRA account information on there and the payment and pay it that way. Pharmacy, instantaneous being billed to the insurance, so you'd be able to swipe your card at the pharmacy. Are you providing cards or is it self-submitted?
I think it's gonna be cards.
Okay,
Still working out those details, but
okay,
I'm pretty sure everyone's gonna have a card.
It will definitely be cards.
Okay,
okay.
I like that.
I wasn't sure, so I listed all the options here, just in case, cover our bases. So, if you have a card, it's a lot easier to deal with, right? So you're at the pharmacy, they tell you how much your medication is after Excellus, you swipe your HRA card. So recently I tabled next to Aflac. I don't know if you know Aflac.
Yeah.
All of their reps were income were ducks, and it was hilarious, because all you hear is quacking throughout the table, so sorry to call you out on that, but that's great. So these are the total monthly premium rates for 2026. These are not your cost share, so don't get sticker shock here. So as you can tell, moving to the bronze plan is gonna save a great deal of money compared to the classic blue premium rates. And platinum also had savings moving from classic blue to platinum. Now both of these plans are shifting to all bronze for next year, is our understanding.
So can you go back to slide just so I understand?
Yeah, going back.
So that 1607 is what the city pays, and we would pay our percentage out of that, correct?
Yes.
Okay.
Yes, so this is so when we bill the city every month, this is what we're billing. So for every single, we bill 1618. For every family, we bill 1607 or 618, sorry. And then you pay your cost share to the city.
And insurance is always paid a month ahead, so whatever I pay in December is what my January stuff is, correct?
Yep.
Okay.
So you can expect your first paycheck in December to have a lower deduction for health insurance.
Should the council choose to accept the plan?
Should.
Got a point.
I'm just
Yeah, no,
playing
that's
this,
true.
play this all out.
Right. Didn't know that hadn't happened. Rich.
That's not happening.
Okay,
This is what these meetings are all about, to.
To educate us.
So we compare it.
that's great. So
And I
that's the
appreciate
main
the time to be
focus.
here before I forget to say.
Yeah, no problem. No problem. So comparing benefit wise, the classic blue plan is what we call our old plans, right? So they are Cadillac, you barely see any medical bills, they're rich plans. They're also being phased out because they're really expensive plans. And they're not always being used in the most cost-effective way. So for example, if a retiree has Medicare as their primary and then classic blue as their secondary, they're really overpaying for health insurance. Just an example. So, the idea was this year was to offer platinum voluntarily. Some people shifted over to reduce down some of those costs. I haven't heard a single complaint about people on platinum, so that went well. So then the idea is to have further savings and shift to bronze. But as you can see, classic blue has a relatively small deductible, $50 for individual, $150 for family, versus the bronze plan, which is at $7,000 individual and $14,000 family. So that's a big shift. So to counteract that shift, an HRA is being funded to support that extra expense of the deductible. And as you can see, with max amount of pockets, classic blue is relatively low compared to the other plans. That means it's pretty easy to reach your max amount of pocket every year, and then you have 100% coverage for the rest of the year on a classic blue. So you're not seeing a lot of bills throughout the whole year. Maybe just the beginning part of the year if you see doctors frequently. Whereas the bronze plan does have the same max amount of pocket as the deductible. So once you meet your in-network deductible, you've also met your in-network max amount of pocket. Keep in mind, there's two different buckets for in-network and out-of-network, okay? So if you're going out-of-network and you're having claims, those are going towards your out-of-network deductible. And your out-of-network max amount of pocket, which is part of the reason why the city is suggesting funding at $21,000 per family to counteract. Has that shifted since we talked last?
No, the city's funding at $35,000 per family
Oh.
and at 17 or whatever it is, 21,000 for individual. No. 17.5 for individual, sorry.
Okay, so are the extra funds to be used for dental and vision?
No, the extra funds are to cover if somebody hit both their in-network and out-of-network out-of-pocket max, it would be fully funded.
So one more time in the figures, it's 30.
35 for a family,
The two added together.
17.5 for an individual.
Okay, so you're funding the full in-network out max amount of pocket and the full out-of-network max amount of pocket. So essentially, they see 100% coverage.
100% coverage.
Minus any balance billing that's not paid for by any health insurance ever, not even Classic Blue.
Such as.
So balance billing, glad you brought that up. When you go out of network to a provider, and let's say they bill $400. And that $400 is then billed to Excelis, and Excelis says, okay, we're only gonna pay you up for allowable rate at $200. That difference between the 400 and the 200 can still be billed back to the member. And that's called balance billing, so they would receive a bill for $200 for that service.
And that would not be coming out of that.
No,
Nor would on Classic Blue.
no health insurance plan up here will cover balance billing. So if someone's already experiencing balance billing at an out-of-network provider, they will continue to just experience that.
What about that HRA account?
That's not subject to being used for balance billing. It's used for the out-of-pocket maxes.
It's only for allowable rates, things that go through your health insurance. It wouldn't be the balance billing.
Does that happen a lot?
It depends on if you go out of network. So a lot of our members don't go out of network. It's not cost effective. And it's the Excelis network, so it's huge. But I do know you do have a local ambulance that I think is out of network with Excelis. So that could be claims there.
Some mental health services in Tompkins County are out of network that people like to go to.
But normally if they're out of network, it's not because they're just choosing to be out of network with Excelis. It's because they don't take insurance. Like chiropractors, a lot of them may not take health insurance. So you're self-paying, then you'll submit, or they will submit a claim back to Excelis for out-of-network benefits. That's where we've seen
So our
common.
local ambulance service in Portland is out of network?
No.
It was a conversation I had with Mayor Scott Steve last year, was that they were having issues with them billing Excelis.
There's issues with them billing, but I don't believe they're out of network.
Okay.
And they still can't balance the bill because for air transport, emergency services, or emergency hospital services, they can't balance bill.
That's in New York now.
Yes,
Yeah, so only if you were at a hospital and you went to an out-of-network hospital.
which is rare.
Before they could balance bill you, they would have to get you stable, and then they would have to ask you, do you want to stay here? Do you want us to transfer you to a facility that will?
And they have to ask you in writing.
Yes.
You have to sign off on that you're willing to stay at an out-of-network hospital for care. Now, with that being said, all the hospitals around here are in network with Excelis. And our retirees don't really face a lot of out-of-network issues being out of state. We have retirees in Arizona, Florida, California. There's no issue there. Because Excelis uses, all of these plans use the same network. And Excelis uses like a blue card network that's national coverage.
It's same thing with a doctor. If you go to a doctor and they're out of network and they're going to balance bill you, they have to have you sign off ahead of time saying, you're gonna get balance bill for this.
Before they do anything.
Not
before
every
they see
provider
you.
has to do that.
Under federal law, they do. If you look at the,
It's the
guidelines.
No Surprise Act, and
Right.
it has to do with like emergency care and some like urgent care situations, but like if you're going to a chiropractor.
chiropractor may be different, but I think
Yeah.
any doctor has to. We can.
Yeah, but yeah,
But this is all the same with Classic Blue and Bronze. All of
All
these
the
scenarios
same.
are exactly what
Yeah.
you're dealing with today with
Yeah.
Classic Blue.
So if you haven't been billed by your provider for Classic Blue, you're not gonna be balance billed under this one.
so if the city's fully funding the HRA to cover the in and out of network max amount of pocket, if you come back over here to Classic Blue, you don't have that funding with this plan. So you're gonna pay your deductible when you go to see your doctor as outpatient. And then once your deductible is met, it's covered at 80% and you pay a 20% co-insurance until you reach your maximum out of pocket, which is also not being funded. So you're still gonna have bills under the Classic Blue where the proposed coverage over here, you should see no bills.
And if you do, you have a card to pay it then. It's not out of your pocket.
So
The card you're talking about, the people that are on medics, like I'm 78 years old, will I get one of these cards? No.
But you have $0 copay.
You'll be in the other,
You're in the other plan.
you're in the other, you're plan 4.
Yeah, you don't have the big co-pays on plan 4.
That's 5 o'clock.
Yeah.
Yeah, so that's what.
you're just here for the party early, that's all. So all my info is for
Send me a message.
low safety time or after.
we have other retirees that aren't able to attend and we're trying to,
Ask the.
be here for them.
Get it,
Oh, yeah.
or they
You
live
look
out
great
of
for
state,
70.
and all that stuff.
Yeah, I would have,
I didn't know.
I was thinking about 50. So I did bring, it's not every benefit, if you wanna see it line for line, benefit for benefit, I did bring the long comparison charts over here on the table for you to take. I picked up on the benefits that are most commonly used or asked about during the presentations, right? So all the plans cover preventative care at 100%. You don't have to meet a deductible before using preventative care, so your routine physical covered at 100% under bronze. Colonoscopies, mammograms, all your preventative care is at 100%, and it's not gonna hit your deductible. Most of the benefits under bronze, you have to meet your deductible. Once your deductible is met, it's covered at 100% for in-network benefits. All the benefits I'm gonna show you are for in-network. If you have questions for out-of-network, we can ask those too. And they're spelled out over here for in and out-of-network on the charts. So things like a specialist visit, you would have to meet that in-network $7,000 deductible, then it's covered at 100%. Whereas right now under Classic Blue, it has that smaller deductible, $50. But then it's only covered at 80% and you pay 20% until you reach a maximum out of pocket. Mental health is covered in full right now under Classic Blue. The bronze would have that once you meet your deductible.
Could you just give us a couple examples of what you consider a specialist in this?
Sure, so a specialist would be like an endocrinologist, a cardiologist, all the ists. Dermatologist. Those would all be considered specialists. Chiropractor is not considered a specialist, acupuncturist, even though they have an ist, not a specialist.
Okay.
Does that include oncology?
Yeah, oncology could be considered, an oncologist would be considered a specialist. Yeah. Good question. So right now under Classic Blue, you have covered in full for urgent care, emergency room, inpatient stays, ambulance. There is no deductible that applies to those under Classic Blue. Under the bronze, the deductible that applies and then it's covered at 100%.
Can we go back one slide real quick? I have another question.
Go back.
Are the mental health services, are they subject to the balance billing that you said before?
You go out of network. If you're in network, there is no balance billing.
For both the current Classic Blue and the proposed bronze plan?
Correct. Yep.
Thank you.
Skilled nursing is not what it sounds like. This is not, I'm gonna go and stay and live in a nursing home for the rest of my elder years. This is acute care. Okay, so you fall, you break your hip, you need inpatient rehab, so you can do the 6 stairs that are at home. That is what skilled nursing facilities are. So it's only for acute care. So right now it's covered in full under the Classic Blue, under bronze, it would be covered.
I'm sorry, I have another question. Do you have a list of in-network and out-of-network providers for mental health care? That's easily accessible.
So if you go to the Excelis website, excelisbcvs.com, and if you get on their homepage, they have tabs up the top and you click find a doctor. And you can look up any doctor you want. It's based on zip code normally for your search criteria. And you can see if they're in and out of network. The lists are so vast, they no longer print them. It has to be online to find them. If the doctor doesn't come up on the find a doctor tool, it means they're out of network. But I can email that to Christy after to post and share.
Yes, thank you, please.
There is a day limit on skilled nursing for bronze in the platinum plan that Classic Blue doesn't have. But I'm gonna be perfectly honest with you. We did a study on this a couple years ago on usage for our platinum plan, because originally it was 45 days per year under the platinum. We did a study and we hardly saw anyone reach the maximum days per year. but we increased it to make sure everyone would have that benefit. Hospitals no longer want to keep you, right? So it used to be you go in for a knee replacement surgery, you're there for 3 days overnight. Now it's send you on your way the same day you got your new knee put in and off to home you go. So it's very different where they don't want to keep you in skilled nursing. They want to send you home. We don't see a lot of cases that exceed 100 days.
So a skilled nursing facility, for example, would be like a rehabilitation place, like we have a couple in the
Yes.
city here.
Yep.
Thank you.
For acute care, yes.
That 200 days per incident,
No, per year.
and if you were there for the other 165 days, does the city cover that out-of-pocket cost?
It's not covered by your health insurance, so I don't believe so.
If you went over 165 days and it was for,
200.
well, if you went over the 200 days. And it was for a rehab type situation, because this is only covering rehab, this is covering long-term care.
Right.
If you know, need to go to a nursing home just for nursing home care, you don't get the 200 days. The city would pick up the amount that would have been covered under classic blue, so yes, that 165 days, if it was for rehab, would be covered.
But would it have to be the same rehab, like suppose you did it on knee and you went in and you were there for 100 days. And then you needed a new hip and you went in for another 100 days. And then, I don't know, what else can go? Oh, that's shoulder, what else? Shoulder. Shoulder go. And you have to go again.
Because the benefit under classic blue, the city has said anybody that would have had this benefit under classic blue. The city will reimburse them if it was a classic blue benefit that you don't have under the bronze plan.
Okay, so you could get knee, hip and shoulder and go 365 days in skilled nursing. And it will be covered.
Theoretically, yes. I don't think it will happen, but yes, it absolutely would. If it was the perfect storm, yeah. But
And that wouldn't be covered through an HRA card. You're not gonna wanna be swiping the HRA card to pay for those additional days. You'd wanna bring that back to the city.
right, you would want to bring that to the city and we've said you either have the option, pay it and we'll reimburse you, or bring us the bills as they come in and we'll just cover the bill.
Kylie, I think last year when we were talking about the Medicare supplement plans, we touched on this topic, and I think it was mentioned that basically if you're in skilled nursing facility for more than, say, 60 days, they're probably gonna find a different path for you. Is that still your opinion?
So Medicare allows up to 100 days. But normally, if you reach 100 days, which is very rare on Medicare, they're normally asking, are you ready for long-term placement? Or do you have support at home to return you home in the state you're in? Which maybe you don't have full mobility yet, and they're looking at it going, you've been in an inpatient PT for 100 days and you are not progressing. You have to make progress. If you're not progressing, then the conversation is, are you ready to go home in the state you're in, or are you ready for long-term placement or other supports?
And that's gonna be the same with classic blue. The days will
All
be
of
cut
it.
off as soon as you reach maximum medical improvement.
Right. Right. It's not like, okay, you're here, it's a spa stay. You have to be doing the work and making progress. If you're not making progress, then the insurance reevaluates and says, what are we paying for? Are we paying for custodial care? Or are we paying for you to advance and progress in your treatment?
So the likelihood of you staying 200 days in a year is pretty low unless you break your knee
Yes.
and shoulder and hip.
And hip and. Every joint.
I don't envy that, like, that sounds horrible, so let's not wish that on anybody.
Gotta be a little more careful with that.
Yeah.
I haven't had anything recently.
I think somebody's out to get.
Talk about the things that aren't included, like private duty nursing, private home, that's not covered on the bronze plan, right?
So private duty nursing and in-home nursing are two separate things.
Okay.
So private duty nursing is care that you're getting in a hospital from an outside nurse. That is covered under classic blue, not covered under bronze. In-home nursing, let's say you go home and you're homebound. So you can't make it out to get to your PT appointments. You need PT to come to you in your home. That is covered by bronze. There is home care coverage through bronze.
So Randall, you gonna cover those costs too? On that one that's not covered?
Private duty nursing, can you give us an example of that?
It's difficult too, because most people don't get it. Most people don't use that benefit, let's say it that way. Private duty nursing would be you're in an inpatient hospital facility and you contract out to get a separate nurse care while you're in inpatient. It's very rare to be seen because you're in a hospital setting with nurses and doctors that are caring for you already, and that's not billed separately like private duty nursing. It's included in your hospital stay.
So the same thing would apply though, Bill. If it's something Classic Blue would have approved, yes, we'll pay it. But just because it's a benefit under Classic Blue, the private duty nursing is something they will pay. It's not something they do pay for every single person. There would still have to be some sort of a reason why they would approve private duty nursing. Correct?
Yes, but yes, it would be difficult to show them meeting the criteria when they're on a different plan that would just automatically deny that claim because it's not covered. We can't then run it through
No,
Classic Blue,
I understand that,
something
but
like that, but yeah.
But
But we could send you the criteria and we
Right.
could see if they could provide documentation that fits the criteria and then you.
if you're Michael Jackson and you have an anesthesiologist.
A special one.
Yeah. That's not covered on any.
Right.
Yeah, he's dead, so he probably won't.
Why he is.
Now chemotherapy's there, what about radiation?
I think I have it on the next slide.
I have another question. You had mentioned private duty nursing being covered under Classic Blue, but not bronze, but there is something covered under bronze that wasn't Classic Blue. What was that?
The home care is covered under both.
I thought I heard you say something was covered under bronze, but not Classic.
I mean, we are coming up on like vision and hearing and that's not covered under
Okay.
Classic Blue, that's covered under
Okay.
bronze, but
Maybe I.
I don't remember what it said now.
So, speaking of chemotherapy, one of the terms that you used earlier that we've heard is at the allowable rate, like it's covered at 100% at the allowable rate. Talk to us a little bit about that, because when I got my chemo through occupational cancer, Classic Blue covered everything. I think Ms. Green would ask you to run some numbers for me specifically to compare the two plans. And I understand you're super busy.
Yeah. Yeah, I did send that request out.
Okay, perfect. So
Yes.
for me, this is near and dear because leukemia is not curable. It's gonna be hopefully 10 years or more until I have to get it again, but it's coming back.
You want to know the coverage is there when it does.
And how much? Because this last time, zero out of pocket for $100,000 plus worth of liquids to be pumped through my vein and to see in here at the allowable rate, what's that rate?
Okay, so health insurance does something for all of their members, and we rely on Excelis to do this for us and our members, which is negotiate pricing with providers. So they have, if they're an in-network provider, they've signed a contract with Excelis saying, we know that these are the rates that you will reimburse us at. So then there's a retail rate, which is, let's say the initial retail that they're billing Excelis is $100,000. And then the allowable rate for that is only $45,000. Because they've signed that contract with Excelis, they accept the $45,000, write off the difference because they're an in-network provider and process it through.
is the Excelis allowable rate any different from Classic Blue to bronze?
No,
So that allowable rate's exactly the same.
exactly the
Okay.
same.
Yep.
Yeah.
Just the way that's worded.
I know, and there's a reason I'm saying it, because if I say, oh yeah, they'll cover it in full, and then you see your bill and you're like, no, Excelis only paid 45,000 of this $100,000 bill, they're not paying it in full. That's why they're not paying it in full, because they have that contract.
Yep, that makes sense.
And that's why it works out better for the members if they stay in.
Rome is still in network. They just signed another agreement this year. I think it was, got done earlier last year.
Yeah, St. Joe's was a little messy, but they did sign back up for another 3 years of Excelis. Yeah, and Well Now is back in network with Excelis as well.
Pre-authorization, that's another question everybody has, pre-authorization, not with the Browns, right?
No, you do have prior authorization requirements with the bronze plan.
Mhm.
Are you asking for medical or prescription or both?
Medical.
Medical, it's diagnosis driven. So there's certain procedures that may not require prior authorization depending on what your diagnosis is. And then if you have different diagnosis, they're going to ask for extra documentation from the doctor's office to approve that prior authorization.
How's that compared to classic?
Classic Blue still has prior authorization requirements, but not as many. Because those are pieces that were put in place later down the road. So Classic Blue started with us at the beginning. We've added the metal level plans a couple years later. And realized that to help kind of control costs, prior authorizations are a helpful tool when it comes to claims, to make sure that we're just not blindly paying for everything and making sure that they meet certain criteria for us to pay for those medical expenses.
But you hear horror stories about people
Waiting.
who required pre-authorization, got it, sent it into insurance, and they said, oh yeah, no, we're not gonna pay that. And then,
Or they take months to
Right,
approve it,
right,
when the person may only have days before they need this procedure.
So emergency is totally different. So if you go to the ER and they're like, we really need to get you an MRI right now, there's no prior authorization required for that. It's an emergency. If you need knee replacement surgery and your surgeon says, I want an MRI of your knee before we schedule you for surgery, that may require prior authorization, but it's not something where the member should be put in the middle. Okay, so your provider contacts your health insurance and says, I want prior authorization for this MRI. Here's the documentation. We work with Excelis, who does it all online. They have a system, you log in as a provider, you enter everything, you upload your office notes, and then the prior authorization is then emailed back to the office. With that being said, is it perfect? No. No, it is not perfect. So that's part of the reason why you should be calling me. So I actually will help people who feel like they're not getting a good response, like maybe they're waiting too long to get a prior authorization. Maybe they don't understand a prior authorization was denied and I'm not sure why. I can help you follow up with the doctor, help you follow up with Excelis, those types of things.
So, again, speaking from personal history, thank you personally, because when I went to Sloan for chemotherapy, they did the pre-approval process. I actually checked in the hotel. Sloan called, said, hey, we still don't have your prior approval. So, it was a Friday. I emailed you. You're like, no, it got done. Here it is. You sent it right down. We forwarded that to Sloan. So thank you for that. But these things do happen, and my chemo was like months out from scheduling it and all that. So I guess those are some of the concerns with having more prior approvals on the brown plan than the classic blue.
Right, is that
Potential for
concern?
those, yeah.
And I think one thing that's important to know about with pre-authorization, the provider is a very important part of prior authorization. If the provider codes something wrong, if the provider sits on it, if they fax it to the wrong place, which is one of the reasons Kylie has been so helpful with that, is Kylie will be the liaison between Excelis and the provider to say, can we please get this information, or why did you code it this way? They're being told something else. So it's not always Excelis hanging on to the prior authorization. Sometimes they need more information and they need that handholding from the provider. Which regardless of what your plan you're on, that service is available.
Right. So just another thing to point out, which we've kind of already covered, but there are visit limits to PT, OT, and speech for outpatient. Under Classic Blue, there are no visit limits. Under the Bronze Plan, there is a 60 visits per year. That's total, not per body part that gets injured. But just a heads up on that. But then you meet your deductible, it's covered at 100%. And then you could be using your HRA card to pay for that deductible amount. Dialysis is covered in full under the Classic Blue and the Platinum Plan. Bronze, you have to meet the deductible first, and then it's covered at 100%. I mean, I can read these to you, but I know you can read them yourself too. One of the benefits not currently offered under Classic Blue is acupuncture. That is covered under the Platinum and the Bronze with 10 visits per year. Orthotics, we also cover. Bronze would be at 100% after you meet that deductible. Just make sure they're billing it through insurance before they hand them to you. Classic Blue doesn't cover adult routine eye exams, pediatric eye exams, or eyewear or hearing aids. So all of those benefits are under the Bronze Plan. The Bronze Plan does have $100 eyewear allowance after deductible. And then pediatric eyewear is covered at 100% after deductible. As well as diagnostic hearing exams and hearing aids are covered at 50%. Prescriptions. So we use the same drug formulary for all of our plans. So if you're on Classic Blue, you're on Platinum, you're on Bronze, it's the same drug formulary. So if your medication right now is a tier 2 under classic flu, it'd be a tier 2 under bronze. We use the same pharmacy network, so you wouldn't have to change pharmacies. We use the same mail order pharmacies, so if you're set up to get your meds through mail order, all you'd have to do is call them with your updated ID card, January 2nd. You don't have to get new prescriptions and you don't have to change pharmacies.
90-day mail order on that?
Yeah.
Okay.
Can we go back a slide? I have a question about fishing coverage.
Me. There we go.
So with the bronze plan, that would eliminate the need for any vision coverage aside from bronze or no?
Well, we only allow $100 for eyeglasses. Now, I don't know about you, I wear contacts and eyeglasses. I can't find a pair of eyeglasses for $100. Okay. And I mean, the rest of it, you would need to be going to an in-network Excellus provider. So making sure that eye doctor takes Excellus and they're in-network.
Sorry, I was confused.
So,
And the exam would be covered after the deductible, but only $100 toward eyeglass.
right, yep,
So I have a logistical question. I go to the eye doctor, pick up my glasses, they're $110. I say, put $100 on this card. And they say, oh, we did the whole thing. So I'm coming to you guys begging forgiveness for the extra $10. I mean, the eye doctor's not gonna block it and limit it to 100, so.
so the HRA card kind of works like a credit card. So it's the same idea as if you went to the grocery store and they're like, oops, I accidentally overcharged you for this. They refund the money back on the card, then recharge it for the right amount. If you catch it. If you don't catch it, you might have to pay it back to the HRA because it wasn't a valid expense. If they audit that claim.
And because the eyeglass is $100 allowance, it's not really subject to the deductible, correct?
It is subject to the deductible.
It is,
So
okay.
you have to meet the deductible and then it's covered at $100
Right.
allowance. The other thing is like making sure that if you're getting eyeglasses, one of the things that's not covered is transition lenses. Or the ones that change the light, those are not covered by health insurance. So if you're getting that, that's out of your own pocket, not out of the HRA dollars.
But the frame,
Frames, contacts, lenses, all that stuff is
I mean,
covered.
$100 isn't gonna get you very far, so it doesn't matter if you have those kind of lenses or not.
Yeah, but I'm just making sure you're not swiping your HRA card for all the bells and whistles. And it's not really paid for by the health insurance. You wanna make sure that it's something that would have been paid for by your health insurance. If you're using HRA dollars,
When you just be putting $100 towards the $550 the glasses cost.
you could do that.
Yeah.
Yeah.
Yeah, we don't have to make that too much.
And we will still be offering the existing vision insurance if people wanna continue to carry that to cover what it covers.
For active employees.
For active employees, yeah.
So the other piece about the drug coverage is, these don't have a deductible that needs to be met before you go to the pharmacy and get your medication. Whereas the bronze plan, you have to meet the deductible before the health insurance kicks in to help pay for your medication. So I'll give you an example. I'll use Eliquis. Hopefully you're getting it through CanRx, I'm just saying. But if you go to the pharmacy and you get your Eliquis and you're on classic blue, it's a tier 3 medication. So you're gonna pay your $40 for your 30-day supply. Under the bronze plan, you go and get your Eliquis, let's say it's January, so it's the beginning of the year, you haven't met your deductible. You may see them, they may tell you that it's gonna be $485 for your medication. That's because you haven't met your bronze deductible, and that's where you would be swiping your HRA card to pay that $485 for your medicine. So I don't want you to go into sticker shock. I've gotten these phone calls before. I'm at the pharmacy, they're trying to charge me $700 for my meds. Okay, do you have your HRA card? Yep, swipe it. So I'm just giving you the heads up before you get there. That is something that will happen because it's all of your prescription expenses and your medical expenses that are going towards that deductible.
So Kylie, why would I meet CanRx? I've got an HRA card. My deductible is being covered, 0 copay after that. Why would I still want to use CanRx?
So CanRx mails you a 90-day supply to your house for 0 copay. The benefit to you is you're then not spending your HRA money on a medicine you can get for free somewhere else. So that HRA money can be used for your upcoming knee replacement surgery, or maybe there's other, they don't do temperature controlled drugs, so maybe you need to get a temperature controlled drug through the pharmacy that's expensive, you have your HRA funds to do that. And it's also convenient because it's mailed right to your door.
And how is that helpful to the consortium?
Like, I know these questions. By doing that too, you reduce down the claims that are affecting the consortium, which helps keep our premiums lower. We keep our claims lower, we keep our premiums lower. So it's kind of a group effort to help everybody.
Is there a allowable rate for prescriptions?
Yes. So Excelis contracts with drug manufacturers to work out allowable pricing for medicines. So Eliquis originally, if you bought it retail, should cost you close to $1,000. That $485 is the allowable rate.
Okay, and obviously, even though it says right there, it's a $10 copay, if my allowable rate medicine is less than 10, that's the limiting pay.
Yes, so this is up to that amount. So if the drug is cost less than that, you would pay the lesser of the two amounts.
So I know a couple of people are on some statins and they always say, well, why am I not paying 10? Because it's 10, 25, 40.
Yeah.
And I thought it was allowable rate, now I know.
Yes, you are right.
Okay.
Any questions on medication coverage? These are the two mail order pharmacies that are available. The reason I bring them up is because you can get, if you're on a maintenance med, the dosages don't change. You can have a 90-day supply shipped right to your home. You don't have to worry about, is the pharmacy gonna be open on Sunday at 6 because I'm out of meds by then. The other benefit is the claims are reduced. So Excelis has contracts with these pharmacies to reduce down the drug costs to us. I will say, Express Scripts is on the back of your ID cards. If you're looking for more human interaction, Wegmans home delivery might be where you want to be. Just saying. So I did include the information so you have it.
And Wegmans will actually set you up with that from one of their in-store pharmacies if you want to.
Yes, the other nice
So
thing
if you
is,
really want to do it face to face, you don't need to call somebody, you can go into any Wegmans and they will set you up for the in-home deliveries.
no, it's
Not that I'm shilling for Wegmans, but.
and on the flip side, you don't have to be getting your meds at Wegmans to do Wegmans home delivery. You can sign up with them online or over the phone. You don't have to have it all together. I did put this information in here about creating an online account. If you're anything like me, I hate another app on my phone, but I swear this one is actually handy. Especially if you're gonna go to a high deductible health plan. If you have the app on your phone, you can look and see how much you've met of your deductible. You can cross-check it with how much you spent with your HRA. So you can also have access to your ID card if you lose it all the time, like you and daughter does.
No, it's off the plan.
No, I know, it's different. No, I'm kidding. But there's a lot of good features on here, like if you're looking for a pharmacy, checking providers, looking at benefits, all of those things are very handy to have.
Can I find my in and out of network doctors on the app?
The app, no, the website, yes. Yeah. The app does have limited features where it's,
Excelis, is that?
Yeah.
Should put in Excelis. Store.
it's excelisbcbs.com. In the app store, yeah, you'd be just looking for the Excelis app. Yep. So I know Elin had mentioned it before, but talking health insurance can get really personal really quick. Maybe you're undergoing a treatment that no one at work knows about. Maybe your wife is sick at home and no one needs to know about it at work. I understand that. You're welcome to reach out to me directly. This is my direct phone number. Jessica is my benefit specialist. This is her direct phone number. And when I say direct, you're gonna get us or our direct voicemail that's private, protected with passcodes and things, so you can leave detailed information. We also share an email address. We're the only two that look at this email. If you have questions, you can email it to us. I have to do the IT plug. Do not send HIPAA protected data via email, please call us. But if it's a general question, feel free to email us. But we're here to help you navigate it. If you want us to compare claims from last year to what if I had bronze, what would it look like? We can do that. If you want us to look at drug tiers, we can do that. If you want help enrolling in Canada RX, I can help you do that.
And I will just say, Kylie will call you back within 24 hours typically, unless she's out of the office. So. She's very responsive.
That she is.
Elon, I called you the other day, you talked about that HRA card, and how there's some sort of tax implications or something happens with that. Explain that, that's a problem.
Yeah, I'll explain that.
Yeah, so when you have Medicare, it was a little marbled on understanding, are they funding an HRA once you have Medicare? Cause there's tax implications to the member. If they are, they're not. They're both shaking their heads, they're not. So if you're on Medicare, you can't get, if you get HRA funds, you may be tax liable. But they're saying they're not doing that, so we don't have to worry about it.
The HRA is only for the bronze plan.
Right.
Which you would be on until you turn 65 and then transition.
Until you enroll in Medicare.
We do need the evidence of documentation coverage, evidence of coverage documentation.
Yeah, I did send you the SP, well, Elon did.
That's like 200 pages.
Yeah,
That breaks it down.
that's our evidence of coverage. If you're looking for benefit summaries or summary of benefits, that's on the landing page for the city of Portland on our website. And I think you sent that link as well. And that's more broken down, easier to read.
Layman's term.
I read them all, but I'm just letting you know, that's easier to read.
Randall, is there any, with the people on the bronze plan, is there any way to get wording into the retirees that we will be covered on all costs out of pocket? That's important to the retirees. I think you could sell that to the retirees a lot easier if you had that with the bronze plan, is to having that wording saying that we're covered at all costs above the 35,000 or whatever. We need to have that wording. Is that possible?
We can't say that because that wasn't the case with Classic Blue. Because if you were balanced bill under Classic Blue, you'd be balanced bill under the bronze. We're saying we'll cover everything that would have been covered under Classic Blue. But we're not saying that if you go out of network and do something that you get balanced, that you'd have gotten balanced billed for under Classic Blue, that you're now gonna get paid for it, that you're under the bronze.
Okay, but anything they got
Anything
paid,
that would have been paid under Classic Blue.
they will get paid for.
Yeah, there were the two examples that came up. The one was the OTPT speech,
And
and the other one was the
private
private duty nursing.
And what makes it
But
equal.
the skilled care days, yeah.
Which.
And I don't think you're gonna see 60 OT visits either, but that's,
And
if it happens, if it happens.
and what makes it equal or better is the fact that the city is picking up the 35,000 or the 75.
And the city's picking up, so under Classic Blue today, they could have $1,200 out of pocket as a family. For their maps.
Yes, yeah,
And they would have their tier payments for all their pharmaceutical.
yes.
Under the bronze, with the fully funded HRA, there will be no out-of-pocket match that they'll be responsible for. And there's no tier payments for pharmaceutical.
And because it
And the
would have
premium's
to,
much lower.
because it would have to continue to be equal or better forever.
That's locked in.
The plan is locked in, not.
And the HRA.
And the HRA, I mean, cause that, the HRA is.
See, I guess that's the thing that, I know this doesn't turn you guys, but that's the thing that makes me nervous, is that. If for some reason 10 years down the road, all the players are different, you guys are gone, and they say, look, this isn't feasible for us, we can't sustain this. So the plan is the bronze plan. Now that's what you have as your foundation of as good or better, not with the supplements of the city. The promise, which the promise is that the goal keeps changing with the promises, because my promise when I retired is gonna now be different than what it is now. So at what point is this gonna be different?
You have your promise of equal or better to what you retired under, is what the city has to
So the
maintain,
plan that I was.
the coverage that you were on. That's gonna
At the point of
at
retirement.
the point of
That
retirement.
never will change.
The good news is, by the first week of February, you're gonna have had the first city retiree retire under the bronze plan with a fully funded HRA. Now that new bar for equal or better has just been raised. Because the city's not gonna say, well, this is what you had, this is what, they're gonna say, we have to reach the new bar, 'cause they're gonna treat all the retirees the same. They're never gonna say, oh, let's take these 10 retirees and put them here, because this is what you had, you retired, you had this, you had that. So the bar is being moved up by doing that.
What if the fund, the city can't fund that? Like they're saying they
They
can't
have
fund.
They have to, just like,
They
then
have.
they need to find an alternative.
But they don't have to fund what I retired at, or that's being changed.
Well, equal or better.
Equal or better,
They have to be equal or
they
better.
can't change it, what you retired at, I mean, they could have taken, if, say there was a classic ink for United Healthcare. The city's not beholden to stay with Classic Blue, they're beholden to stay with something that's equal or better. They're staying with the Blue Cross Blue Shield network. And doing it, structuring it differently than Classic Blue did, but the actual benefit, to me, is moving the bar up. There are a few differences that Bill talked about, and the city's gonna cover those if, when, and if they happen. But for the most part, lower premium, less out of pocket. Most people would agree is equal or better.
That's all gonna be in writing, what, the questions that Bill had,
Because the council's gonna adopt a resolution saying,
or not.
if,
Just saying.
no, or not, I
Just
agree,
saying.
but I'm saying, in order for me to see this being implemented. The linchpin for the bronze plan is, number one, that fully funded HRA, which is part of what keeps it equal or better. And then number two, for those rare occurrences that could happen, the city's gonna step up and do what they should do on those. The union contracts, which again have not been ratified yet, nor has council approved, but assuming that happens, they're all going to be all switching to this bronze plan. The management team will be switching to this bronze plan, assuming council chooses to amend the management plan. Again, it's all subject to council approving this. That's gonna set that bar with that bronze plan, with that fully funded HRA. And once I'll pick Dan Edwards, if Dan Edwards retires next year, once Dan is a retiree and that's his equal or better, that's the new bar the city has set for itself.
Because they're not gonna put Liz Starr on this plan because that's what she retired under, and Dan on this plan because that's what he retired under, if something were to change in the future. So now the bar is set with bronze
Yeah.
and.
Well, what we all retired under was as good as or better. And that does not ever change.
Does not ever change. The worst you could ever get is what you retired on, something that was as good or better. I'm telling you, I feel that by doing this, the rising tide is pulling up all boats. And your old equal or better has just been made a little bit better than it was.
So, but the retirees are not gonna be on this plan. We
Retirees,
go to an advantage plan, correct?
if you're Medicare enrolled,
You're over 65, you go to an advantage.
but if you take a police officer that retires from 41 until they become 65, they would stay on this bronze
Right, but
plan.
once you become 65, you
You
go
move,
to the advantage plan.
right,
Now, is that as good or better than the one we retired under?
that's the next,
At
if
5 o'clock.
At 5 o'clock's gonna be the next show. I'm gonna tell you the answer is yes.
Yeah.
Rick heard the earlier show. The question that was just asked, Rick, is do you think the Advantage plan is equal or better to the Classic Blue?
On its face, from what
I
I've seen,
agree.
from what I've seen.
So I mean, listen to the presentation that's next. I invite you to stick around for the next hour, especially if you're gonna be somebody that's either close to going on to the Advantage plan or would be on it today.
Right.
Stick
We're all
around.
gonna get there someday.
Stick around and hear what they have to say. This one, the bronze plan feels a lot different than Classic Blue.
It does, it works different.
It works different, it feels different. The Advantage plan really doesn't work or feel any different than Classic Blue.
Why can't the
It does
retirees
work
be on that same?
different.
But it doesn't feel that much different because you're not having to swipe that HRA card. to
Right,
get the
it's
benefit.
not.
Yeah, if you're over
Right.
65,
You
why
keep
can't
throwing
you
your
get?
Medicare picks up 80%, and the
Yeah, that's
plan that the other.
A
plan that
Medicare
they're
Advantage-
about is 20%.
A Medicare Advantage
If
plan
you go
doesn't.
to an advantage
work
plan,
that
why
way.
can't the retirees just stay on?
I was concerned about the same thing, and spoke to Kevin, who
He's in the hallway, we didn't come in.
Oh.
Right, and it's. Like the Advantage plans that you see on TV, like, oh, call 1-800. That's individual kind of stuff. This is employer based, which is different.
Employer-based group.
Right.
Group coverage that is not available on the open
Right.
market. So,
Oh,
but yeah, Kevin.
He'll walk you through all the ins and outs of it.
And just to mention, when you leave the consortium on the Medicare Advantage plan, you'll no longer have access to Canna RX. So I know you have quite a few retirees that take advantage of that program. We may want to make them aware before the end of the year that they will need to get new prescriptions and get them to a retail pharmacy. If you are no longer on a consortium plan, you no longer have access to Canna RX, which is the voluntary prescription program we talked about for saving money on your meds. So I know there's quite a few retirees that have used that program or are using that program. So they should be made aware that they won't have access to that going to the Medicare Advantage plan, so they have time to get a new prescription to a retail pharmacy, so they're not going without their meds.
So then I shouldn't ignore that letter that Excel sent me.
Are you 65 plus on Medicare?
You
Then-
should,
Right.
but the one thing you will see is where your tier payments under the Classic Blue were 5, 20, 40,
10, 30, 40, 10, 30, 40.
10, 30, 40. They're 0, 1, 1.
Your copay is $1.
Your copay will be $1 under the, I mean. Canna RX might not be available for free, but even if it's a tier 3 drug, your copay would be $1.
They probably had switched to a different brand, and I don't know if it's generic or just something different altogether. And I don't wanna just switch.
If you want to
Jargon,
call me with the
it's
info, I
jargon.
can
Yeah.
look into it for you.
Yeah.
Yeah, we have what's called an open formulary, so every medication should be covered, you shouldn't be told nothing's covered. It may be a matter of, what's called step therapy, so trying something cheaper, it's not really working to help me with my, condition, then I can get the name brand drug. Some of our medications do require that. But that might be the case here, when they're encouraging you to try something that's less expensive first.
Certain things can have other hoops you have to jump through, to like, a GLP-1 or something like that.
Right, prior authorization process.
You can be on some sort of program or whatever the case.
So all of our drug plans, including our MS4, our Medicare supplement plan, have an open formulary.
For the consortium, is it optional for employees? Or do they, from your point of view, do all employees have to do this to go to the other plan? Or does the municipalities have the option of letting retirees opt into it as a volunteer basis?
So for our plan, our Medicare supplement plan, it is voluntary. So you could opt into our Medicare supplement plan. That was brought out last year. Chrissy and I did retiree presentations. I think 22, 24 retirees moved over. With the Medicare Advantage plan, if you were to do open market, bidding, it normally is all or nothing. I know if the Medicare Advantage plan you're going through is Fannie, I believe they offer voluntary enrollment, but you'd have to check with their broker.
Are you talking about the bronze plan?
No.
No, she's talking
I'm
about.
talking about, yeah, not the
the
Medicare.
Yeah, no, I think Sarah's talking about, yeah, the bronze plan.
Bronze plan.
Oh.
Bronze.
Is the city able to offer the bronze plan to the retirees as an option? Or do we all have? to-
Beyond 65 or
No,
under?
no, no, right now today.
So I'm 42, I can retire next month.
Yes.
Can I take classic blue or bronze? Is it
You
just-
could, yes, you could be offered options, but that is up to your employer to determine how they want to roll that out. We at the consortium allow voluntary enrollment like that as long as it's tied to union contract, which it sounds like we're gonna be.
The Advantage plan that they're gonna talk about next, when you're on Medicare, is that still in the consortium?
No,
No.
That's
The
stands.
and it will
Through
replace,
State Alliance.
it will replace your original Medicare, that's what
why
Medicare
they
Advantage.
can't-
So
Right.
speaking
They
of
have their prescription plan on that, you'll explain it, yeah.
the bronze plan, right now we're locked in for 3 years at those deductibles. After 3 years, can you change that deductible or is it?
Our deductibles are not.
They're not locked in for 3 years.
Okay, you mentioned the 3 years earlier, so I don't know if that was the rates or something you're talking about for 3 years. Is that deductible locked in for the life of the bronze plan or will it increase?
So we have to put all of our Palmer metal level plans,
Yeah.
platinum, gold, silver, bronze, that's right, silver. Have to go through every year, what's called an actuarial value calculator.
Okay.
Federal government makes us do it. So we plug in all of our benefits and it spits out a number to us and it has to be within a range. So our bronze plan has to be at 60%, up to 62, or up to 65 or down to 58%. It's gotta be in that range, 58% to 65%. If it doesn't fall within that range, we have to change our benefits to fall within that range to keep the plan in compliance, federal compliance. So we don't necessarily determine when we change our deductible, putting it into an actuarial value calculator. So the deductible could fluctuate.
That could go up annually, let's say.
It could go
Yeah,
up.
okay.
I mean, our bronze plan has been pretty stable. We haven't changed the deductible on it for about 2 or 3 years.
And that's where we would just work with your office to increase the
The
HRA.
HRA would just be increased to match that. The bronze plan is also, I believe it's an HSA qualified plan, correct?
Yes.
Well, that was one of my questions.
So there's certain rules that apply to HSA qualified plans that they would have to comply with to keep it HSA qualified, but it's not really a big issue,
No, it hasn't been an issue yet.
but theoretically, that could be another factor.
Yeah, because in your long form, it mentions this as an HSA plan, there's some questions, so it's the HRA, not that. So
The HR, at this point, the city is not doing an HSA. Did talk to it about it with a couple of our unions. But that, because the HSA, whatever we put in it, you get to keep. So that would be something where a person might have an option of saying, I want the fully funded HRA, or I'm willing to take the risk because I don't think I'm gonna use anything. So you give me $6,000 a year, I'll run the risk, and I'm gonna let that 6,000 build every year. And that's something we talked about, is something that we might consider down the road, but we need to get our, kind of our feet underneath us on this first. But, you know, if I was a 21-year-old police officer, knowing what I know today, I'd be very interested in the HSA. Especially if I was single, because I could be banking that away, probably not using a dime of it, and probably be sitting on $1 million when I turn 65.
Yeah, HSAs are almost like an enhanced retirement benefit, because it goes with you. The second it's funded, you take it with you.
Right.
No matter how long.
That's
you're
just a
here.
new law though, on the IRAs and stuff like that. That just started where the government's.
Relatively,
Yes.
yeah,
It's the new tax.
it's a new tax planning tool. But then, you know, and it's really attractive to the younger generation because people don't stay with the same employer forever. So if they build up a little in their HSA, they drag it with them to the next one.
But the HSA is great because, you know, once you reach Medicare age, you can actually get reimbursed for your Part B that's coming out of your Social Security. You can reimburse yourself.
Yeah, tax
Covers
free.
medical expenses no matter what plan you're on when you walk with it. So but there are benefits to it. There's also rules you have to follow. Otherwise you get taxed for that money. We went to one of our municipalities. I think this was when I first started. Yeah. We had a municipality funding an HSA and the guy at the table goes, yep, I'm gonna buy a new 4-wheeler this year with my HSA. And we're like,
As long as you have receipts to back that up, you can buy your new 4-wheeler with
you
it.
pay the tax. I'm
Right.
taking that money out.
Well,
Yeah.
as long as you paid the bills
Yeah.
out of pocket,
Yeah.
you can use it. I know people that have done that. I don't think it's the best idea.
No,
But there are people that, because they want to use the HSA as an investment, they save all their receipts in case there's ever an emergency and they need to dip into it.
What's the max payout for the Classic Blue over the course of my policy? $1 million, $2 million?
there is no lifetime limit on any of our plans.
Okay.
I have a member at home that looked at your website and it says that Guthrie Cortland does not accept the bronze plan. It's not showing Guthrie Cortland is taking the bronze plan. You know anything about that?
Well, we don't have provider information on our website, so maybe it was the Excelis website, but Guthrie's in network with Excelis, which means they take all of our plans.
And again, the network for the bronze plan is the same as the network for the classic.
Yeah, yeah.
You mentioned that the Classic Blues, been around a long time plan, and, how many of the other 88 municipalities that you service offer the Classic Blue?
Okay, so we have Classic Blue 5150 with the 3T9 RX, that's what you guys have.
Yeah.
No one else in the consortium has that exact plan.
Okay,
We take the Classic Blue, which is the medical, the 5150, and we add it to different drug plans, right?
okay.
So then we have some, it's mainly our founding members that still offer Classic Blue, but not all of them. So I'd say we're probably down to about 5 that offer Classic Blue. And they're slowly negotiating it off of their menu, because it's just not financially sustainable for the municipality.
So the 10 new municipalities that are joining next year weren't even offered by them.
Right,
Like, it's not even an option.
We haven't offered Classic Blue to new members in 5 years, 6 years, longer than that, a while. So, yeah.
How many plans, how many of the plans you have, cities have done it out?
How many cities that we have gone to bronze?
We only have three cities, right?
Well, we got Geneva, Elmira, Portland, I think that members, you mean?
Well, who's the sponsor of the plan? The city's the sponsor of the plan, right?
Well, it could be the village, it could be the.
Village and
Yeah.
city,
Yeah.
county. How many of our membership offer the bronze? I would say probably 15 to 20.
All of the municipalities are listed on their website and the plans that they have available to.
Yeah, if you go under employee/retiree tab, and then you click, plan by municipality, you can click into each municipality. I just don't have that information on the top of my head, but it'll show you which ones offer.
And I would also say there is renewed interest in the bronze plan due to our 18% premium increase. So City of Portland is not unique. A lot of our other, Tompkins County just made some major changes this year. Their retirees are going with the same outfit you're going with. So a huge premium increase causes a lot of consternation.
You were telling the mayor earlier that that was voluntary for him.
It is voluntary through Tompkins.
And just,
The county is also doing the same Medicare Advantage plan here in Portland County,
That's voluntary also.
except for people that retire beginning 2026.
you mentioned earlier the fund balance. Do you know what the current fund balance of the consortium is?
Oh, that's an alien question.
Our fund balance at the end of this year is gonna probably be close to 3 million.
Okay.
It might be less than that, depending on November and December.
And then just, again, trying to get clarification on Sarge's question. If I retire next month, in your world, I can either choose to stay in classic blue or take the bronze, because in your world, it's voluntary, that line's on the menu. I can take it, but the city might have a different plan.
Let me be clear on one thing. Yes, you can have a choice in our world, but that is totally up to the city to decide if they want to have that. Two, if you leave classic blue, we have a consortium-wide policy that says you cannot come back.
I totally get that. I totally get that. Yeah.
Yep.
So, nope, understood.
Okay.
Nope, I perfectly understand. Thank you.
Our next presenter is waiting. in the
Yeah, I'm
hall.
so sorry.
No, it's totally fine.
Randall, what's the next Zoom for the, rods tomorrow, so we can put that out to the retirees?
9 AM.
9 AM tomorrow.
And we'll be here.
And I think again, 6.
When are you here again?
Sorry, Christie, I need to let.
And 4 for the